To switch gears a little bit, I want to talk about a genetic testing issue that is specific to oncology. So, when we think about genetic testing in cancer, there are a couple different things that could mean. We know that there's the germline testing that's ordered or coordinated by genetic counselors, but there's also genetic testing that can be performed on a patient's tumor for patients who have been diagnosed with cancer. One issue that we see coming up in our clinic is confusion around some of this terminology. So we know that some of these are pretty specific. Genetic testing of a tumor, tumor profiling, somatic testing is very specific. Something like germline testing is very specific for hereditary risk. But a lot of the terms on this slide you may see listed, and it may not be clear if that testing is tumor versus germline. So something like genetic testing, cancer sequencing, then NGS testing, those could really refer to either of those types of tests. And just to go over briefly what the difference between those is, when we think about inherited or germline testing, this is the testing that's typically coordinated by genetic counselors and similar providers, where it is testing a blood or a saliva sample, looking for genetic changes that a person was born with. So typically inherited, things that can be passed on to other family members, and something that's present throughout the body. These genetic changes are linked to an increased risk to develop cancer. This testing, the germline testing, can be done both in people who have had cancer and those that have not. Looking at the bottom row, the tumor or somatic testing is specifically for individuals who have been diagnosed with cancer, doing testing of their tumors to look for any specific genetic changes in there that might impact a person's treatment and might give information about how they respond to certain types of treatment. So this testing is typically ordered by oncology providers to inform treatment decisions. And generally, these results are not something that gives information about inherited risk, although I'll cover some exceptions in a second. And they're not intended to look for things that can be passed to family members. It's really intended to look for anything that might impact treatment. There are a couple different ways this testing can be done. So on the left, seeing tumor-only, where just a tumor sample is sent, versus on the right, the paired tumor germline, where a lab actually receives part or sample of a patient's tumor, as well as what's called a normal or germline sample. Thinking about tumor-only, this is generally easier to coordinate because you're just sending one sample type, a tumor that hopefully is available from a biopsy or a surgery. This is especially appropriate for very limited testing, where if you work in a specific disease group where you're just most concerned about a single genetic marker, is it present or absent? Usually tumor testing is very adequate for that. When looking at tumor only, an important point is that it doesn't eliminate any hereditary risk. So if a patient has something going on in their personal or family history where you feel it's appropriate to think about germline genetic testing, that should still be the case regardless of any tumor-only sequencing results. We do see that on some of those larger tests, labs can potentially have miscalls between whether a variant is somatic and confined to the tumor versus germline and hereditary if they don't have that second sample, the germline, to help confirm that. And in some cases, a lab can identify something that they suspect is actually germline, even when they only have a tumor sample, but will always need a follow-up test to either confirm that or rule that out. There are some labs that will accept tumor and germline together and run that as a paired test. That allows them to accurately figure out, is this variant only in the tumor, or is it something germline the patient was born with? Something that's both a pro and a con is this can lead to incidental identification of hereditary cancer syndromes or inherited cancer risk. So it is helpful in the sense that it provides useful information for patients and their families, but is not actually the reason the test was ordered, so is kind of an extra piece to consider. Rarely, this paired tumor germline testing may eliminate the need to order separate germline testing, but usually it does not. this is based on the specific technology and methods used by the lab that you use most often. So the best way to figure that out is to check with them if they recommend follow up with any potential or incidental germline findings. And one note is that a lot of paired tumor germline testing, especially historically, has been done on a research basis. And any germline results from a research study, we're generally wanting to confirm. Lastly, just with the paired tumor germline, it also requires 2 sample types, and sometimes it can be difficult to coordinate getting a normal sample to the lab. Some labs do flag on their reports if there's an incidental or possible germline finding that they've identified based on the tumor sequencing test ordered. Again, the best way to figure out what this looks like at the lab or labs you use most often is to check with them what their policies are for this and what that would look like if one of your patients had this. If you're interested in learning more, there is a great resource from ESMO about different tumor types, how often findings detected in a tumor are actually germline, and how that varies depending on different tumor types and different genes, and they do make recommendations on when to follow up on potential germline variants detected on tumor-only sequencing. There are also a lot of publications or guidelines that may be specific to certain cancer types or disease groups, so also something worth looking into if there's more specific guidance around that.